Hello, and thank you for attending the Pre-Induction Education Session, or PIES, for Naltrexone. My name is Sarah, and I am an addiction and mental health counselor with Addiction Services of Thames Valley. In this presentation today, we will be discussing the addiction medication therapy known as Naltrexone. This is our agenda for today. We will begin with Naltrexone education, and then we will discuss the RAM Clinic, which is a program of ADSTV that offers Naltrexone. What is addiction medication therapy? Medication interventions for the treatment of substance use disorder. This is a harm reduction approach to recovery. Helps to reduce the negative effects of withdrawal and cravings without producing euphoria. Is best used in conjunction with counseling. Today, we are going to discuss Naltrexone, which is a medically recognized treatment prescribed by a primary care provider to those with alcohol use disorder. Research shows that Naltrexone combined with counseling and other social or community supports is an effective treatment for alcohol use disorder. Naltrexone may also be referred to as anti-craving medication for alcohol use disorder. Naltrexone is an anti-craving medication used to treat mild to severe alcohol use disorder. It works by blocking the ability of alcohol to induce the high feeling. Naltrexone helps you reduce or stop drinking alcohol. Naltrexone could be right for you if you are at a point where you cannot continue drinking but cannot stop either. Those with intense alcohol cravings during treatment may experience greater medication benefit than those with low levels of alcohol craving. Treatment is usually a minimum of 6 months, as it can take 3 to 4 months to notice a significant decrease in alcohol use. If after 6 months you're abstinent and no longer craving alcohol, Naltrexone treatment can be discontinued. Naltrexone can help with a moderation or an abstinence goal for alcohol. You cannot take Naltrexone if you are taking opioids. Some examples of opioids include Tylenol-1, hydromorphone, Percocet, fentanyl, and morphine. You should stop taking all opioids at least 7 to 10 days before starting Naltrexone. This is because Naltrexone is an opioid antagonist, which can protect clients from an opioid overdose and reduces cravings. Since Naltrexone is an opioid antagonist, those who are using opioids being maintained on opioid replacement therapy, such as Suboxone or Methadone, or anticipating surgery or dental work that will require opioids are not good candidates for treatment with Naltrexone. Naltrexone's opioid antagonist properties may make it particularly good for those with a history of opioid abuse or dependence who are seeking treatment for alcohol use disorder, because Naltrexone will reduce the reinforcing effects of and curb cravings for both opioids and alcohol. Naltrexone will fill and stick to the opioid receptors, thereby preventing other opioids from attaching and can cause opioid withdrawal symptoms. As you can see in this picture, Naltrexone is an opioid antagonist that blocks the binding of endorphins at the receptor site, essentially blocking the ability to induce the pleasurable or euphoric effects of alcohol. Since Naltrexone blocks cravings, it may enhance the ability of patients to abstain from drinking. By blocking the pleasure of alcohol, Naltrexone also may reduce the amount of heavy drinking in those who do drink. Since Naltrexone is an opioid antagonist, one of the contraindications of Naltrexone is opioid use or severe liver damage. This means you are not able to take naltrexone if you are using opioids or if you have severe liver damage. This is a picture of what naltrexone tablets may look like, as well as what your prescription bottle may look like. There are different brand names available. Revia is the most common. Take naltrexone once daily with or without food for 12 weeks. Naltrexone works best when taken about 1 to 2 hours before you start to drink alcohol. Since naltrexone blocks the body from responding to endorphins, you may notice more subdued effects after drinking. For example, after taking a tablet and having your first drink, you may not feel the typical buzz. Because you don't get the reward from drinking, your craving for another drink may diminish. When someone takes naltrexone, they usually don't feel anything other than a decreased desire to drink. While the drug is safe to take for most people, it does not get rid of the risks of alcohol. Naltrexone might block the pleasurable effects of alcohol, but you can still get drunk while taking the medication. Naltrexone is not habit-forming or a drug of abuse. It does not cause physical or psychological dependence. There is a low incidence of side effects. Negative side effects include nausea, headache, depression, dizziness, fatigue, or anxiety. Side effects are usually mild and short-term and can be minimized when taken at bedtime. Naltrexone does not eliminate or exacerbate the risk of suicide. Naltrexone is metabolized by the liver, so it is important that your liver is functioning well. Blood work is done to check your liver function before and during your treatment to avoid negative effects on the liver. The usual starting dose of naltrexone is 25 milligrams to assess if you can tolerate the medication. The maximum dose is 150 milligrams. It can take up to 3 to 4 months to notice a significant decrease in alcohol use. Decrease your alcohol consumption slowly to minimize withdrawal. The severity of withdrawal is dependent on your level of alcohol consumption. Withdrawal symptoms from alcohol include sweating, rapid heartbeat, hand tremors, problem sleeping, nausea and vomiting, restlessness and agitation, anxiety, hallucinations, delirium tremens, and seizures. If experiencing moderate to severe withdrawal, seek medical attention at the closest urgent care center. Some other considerations for naltrexone. You have the right to voluntarily withdraw from the naltrexone treatment program at any time. If it is suspected that you are unable to drive a car due to a medical condition, which includes intoxication from alcohol or drugs, the RAM clinic is obligated to minimize the impact of impaired driving. Please note, if you have been taking naltrexone regularly with positive results and decide to discontinue, returning to alcohol use will reverse your progress. For example, your brain receptors have changed. Naltrexone is not advised to take while pregnant unless the risks outweigh the benefits. Vitamin B1 or thiamine for alcohol use disorder. Heavy alcohol consumption can result in a thiamine deficiency, which can lead to alcohol-induced brain damage. Dispensing fees for naltrexone. There may be a dispensing fee for naltrexone at the pharmacy. This is dependent on the type of coverage you may or may not have. If you have drug coverage, bring this information with you to the pharmacy. If you do not have a drug plan, you're responsible for payment. The approximate cost for a 50 milligram 1 month supply of naltrexone is $95. If you cannot afford to pay for naltrexone each month, the Sinclair method is one option, meaning you only take naltrexone on the days you are going to drink right before you drink. The only drawback is you may not adjust to the side effects or may experience more side effects, for example, nausea and fatigue, if you are not taking naltrexone daily. For those on Ontario Drug Benefits, or ODB, and private insurance providers will be applied as exceptional circumstances. Some other treatment options for alcohol use disorder, other than naltrexone, may include antabuse or Camprol. At this time, the RAM clinic offers naltrexone only. Your healthcare provider will provide you with more information if these other medications are indicated to meet your treatment goals. Please discuss antabuse or Camprol with your primary healthcare provider if you are not interested in naltrexone. The RAM clinic can offer bridge support and education for family doctors if they are uncertain about how to start this process. The next section of this presentation will include specific program information for the Rapid Access Addiction Medicine Clinic, or RAM Clinic. The RAM Clinic is a program of ADSTV in partnership with the Canadian Mental Health Association. The RAM Clinic operates out of the medical suite of ADSTV at 200 Queen's Avenue, Suite 260 in London. This is a picture of the front of the building and the main entrance. There is an elevator available. This is a photo of the main entrance of the addiction services lobby that you will see upon your entrance into our suite. The RAM Clinic in London offers community-based, low-barrier services for patients seeking treatment for substance use disorders. The RAM Clinic focuses on addiction medicine and offers both medication and psychosocial interventions to meet client goals. The London RAM hours are Mondays, 8:30 a.m. to 11:30 a.m., and then 12:30 p.m. to 3:30 p.m., Tuesdays, 8 a.m. to 11 a.m., and Wednesdays, 7:30 a.m. to 10:30 a.m. Our contact information is 519-673-3242, extension 281. What to expect at the London RAM Clinic. Weekly visits to the clinic at 200 Queen's Avenue, Suite 260. All clients are required to attend RAM on a weekly basis. As you progress through the treatment program, meaning you are stable on your dose and your urine drug screen samples are negative for other substances, the medical team will negotiate your clinic visits and you may be eligible to attend bi-weekly or monthly. Wait times can vary at each visit. Please bring something to keep yourself occupied. It may be helpful to block out the hours of RAM for the day you attend. Urine drug screening is required at every clinic visit. All clients are required to provide a urine sample. The medical team needs to ensure naltrexone will not interact or contraindicate any other substances you are using or medications you are taking. We will inform you of what we are sampling for and will tell you your test results. Weekly visits to your pharmacy with take-home doses. All clients are required to attend their pharmacy of choice every week to retrieve their Naltrexone prescription. Similar to your clinic visits, as you progress through Naltrexone treatment, you will then receive a longer prescription and less clinic visits for a maximum of every 4 weeks. And lastly, mandatory check-in with a counselor or nurse prior to meeting with your prescriber, the doctor or the nurse practitioner. All research states that Naltrexone and counseling allows clients to be more successful with their treatment. Therefore, it is a requirement that you will meet with a nurse or a counselor at each clinic visit prior to meeting with the prescriber. If you are not located in London, but are still interested in Naltrexone treatment, we do offer services in Strathroy at the Gracie Medical Recovery Clinic. These clinic hours are Tuesdays, 8:45 a.m. to 12:30 p.m. and 1 p.m. to 3:45 p.m. The contact information is 519-205-0637. If you live in St. Thomas, the Clinic 217 at 475 Talbot Street will be able to support your goals with Naltrexone. The clinic hours are located on this slide, and the contact information is 519-631-9040. So right now, I would like you to pause for a moment, take a breath, and I would like you to reflect on the information that we just provided and consider if RAM Clinic and Naltrexone is the right treatment for you. If you are not interested at this time, I thank you for your attention and patience, and you are welcome to exit the video and enjoy the rest of your day. It is important to note that primary healthcare providers, such as family doctors or nurse practitioners, may be able to prescribe you Naltrexone if the hours of the RAM Clinic do not work for your schedule. If you are interested in Naltrexone and the RAM Clinic hours work for you, this slide explains the next steps on how to connect with the RAM Clinic. Due to COVID-19, we would ask that you call the RAM Clinic at 519-673-3242, extension 281, to arrange an appointment. Once you are booked for that appointment, please attend the scheduled appointment to complete the referral forms and a physical health assessment that is conducted by our RAM nurses. The referral forms typically take approximately 40 minutes to complete, and the physical health assessments typically take approximately 20 minutes to complete. If you think that Naltrexone is the right form of treatment for you, please follow these steps to be connected to the RAM Clinic. I hope that this video was helpful in answering any questions you may have regarding Naltrexone. Thank you for your attention, your patience and time, and enjoy the rest of your day. Take good care.